Okay, so today we're here with Jake Moyer. Jake Moyer is a physical therapist working at Moti Physical Therapy in Los Angeles. He graduated from the University of New Hampshire with a degree in exercise science back in 2015. And then he went to the University of Southern California, where he got his doctorate in physical therapy, where he graduated in 2019. Since then, he's been working at Moti Physical Therapy, and we have the pleasure of talking with him today. He agreed to sit down with us and talk about life as a physical therapist in a fast-paced orthopedic setting, and then how the NecksLevel device has helped them at their clinic on a daily basis with treating their neck pain patients. So, Jake, could you speak a little bit about the clientele that you work with and like a normal day for you in your setting?
Yeah, our structure is we work on like the half-hour block. So typically on my 8-hour shift, I'll see up to 14, 16 patients a day. That's pretty standard across all of our therapists. The location that we're at here, we see generally the younger adult population. We do have a wide age range though, anywhere from our pediatrics to our geriatric population. But typically, like I would say on average, my patients are like 30 to 35 years old. So you see a lot of like the active adults, those like weekend warriors, people that are really into like running CrossFit and things like that. And then also at this point, especially like those people that are working desk jobs. So we see a lot of like writers, people in the film industry that are like sitting a long time, engineers, what have you, just people that are working remotely at desk jobs, but also going into the office. So it's a pretty big variety of people, but we definitely tend to see more of those, like I said, younger adults and those active patients. So yeah.
So since COVID has came and now potentially gone, do you feel like you guys have seen an uptick in the amount of desk postural related injuries, be it neck pain or low back pain? Have you noticed any trending with that?
Yeah, for sure. It seems actually like that's become a little bit less like more recently, but I think that's just because like there like initially there was a big uptick in it, and now people are starting to go back to work or like have already sought help from us or elsewhere. So like that is not as huge as it was months ago, but definitely like mid pandemic, early pandemic, we were seeing a lot of that.
And when you think about neck pain, can you describe kind of the prototypical patient that you guys are seeing at Moti and your general treatment strategies for them? Be it a focus on manual therapy, or if you're working on range of motion techniques, or you focus a lot on neuromuscular control. Can you just speak a little bit about your general tactics for treating neck pain?
Yeah. I would say generally like our typical neck pain patient that comes in is probably someone that's dealt with this at least to like a subacute chronic extent. Sometimes you'll get those acute people and they're really fun and easy and like you can work them through this pretty quickly. But I felt that with these more on the chronic end, we're focusing on kind of movement re-education, along with manual therapy components. But ultimately, you want these people to become independent and able to self-manage to an extent. Sometimes you'll get to see them throughout their full plan of care, all the way to no pain, 100% function, and that's awesome. And we do, fortunately, work under a large PPO population, so we're not as limited by our insurance here. But sometimes you'll get these patients to 75, 80%, and for whatever reason you've got to end their plan of care, but you want them to be able to manage well with movement, exercise, and things that they can be doing on their own. So manual therapy, yes, is I think important at some stages, but also we want to try to get them moving in a better way that's more, independent, effective, and something that they can sustain through their life, especially these people that are, sitting for a long time at desks writing and, in these positions that are compromising their, body. So
we introduced the NecksLevel to Moti, and it seemed like it was adopted relatively quickly.
Yeah.
Why do you think it was taken up at your clinic? Why do you think physical therapists shifted their treatment strategies to include the NecksLevel?
So yeah, I think prior to using it, we all kind of had a maybe not as comprehensive of a bank of things that we could be giving these patients, weird exercises with TheraBands or, things with having them move their head on a half inflated ball and, stretches and things that maybe didn't seem as effective. And we're also everyone was kind of doing something maybe differently. With the NecksLevel, I think it helps to kind of streamline that. We have this one device that's great for, mobility. It's great for, ramping up strength and endurance using resistances. It's pretty easy to use, and it's got the movements and the exercises that you can do on it are effective, and they're not just like all these random other things with these other random pieces of equipment. So I think that's been really nice to just have that one solid useful device to implement in someone's treatment program. Hey, we see that you can't move this way, or you've got pain in these muscles and tissues, and we're going to start to use this device. And we have this, bank of exercises and things that we can do with this device, and we're going to choose the most effective ones based on what you need. So I think that's been really nice because it's there, and everyone is from the get-go been we're gonna use this with our neck patients. And we were taught these strengthening programs that you can start with isometrics and kind of load up from there, and we're gonna start there and then progress. Or hey, this patient can't turn their head to one way, let's use this device, let's help them, and then it's working. So yeah.
So can you elaborate on how you got the clinic all using it? Because initially it was only you who was familiar with using it. And then can you just talk us through the process of getting everyone on the same page and how that all went?
Yeah. I kind of just did an in-service one day during our staff meeting. I talked to my clinic director, and I had asked her about implementing the device in the clinic already. So it had been there, and, a couple of weeks in after I was using it, and we had time to get everyone together. I did a nice in-service, showed them some of the things that you showed me, and gave them the video tutorials. So we went through all of that together so everyone understood it. And then from that point forward, people started using it basically.
How many times per day would you say this device is getting used with your neck pain population?
I often see it out of the drawer that it is stored in, which is great. It's rarely, I feel ever in there. So either someone's just been using it, or I've even had times where I go to look for it and someone else is using it. I'm like, crap, I gotta wait for it, or do something else. But I would say on average probably at least 10 times a day.
There's a lot of patients now using this device in the clinic. What types of feedback have you heard from your patients or from other therapists' patients as they use the NecksLevel device?
I think that a lot of the patients that I've used it with are happier to be doing an exercise on this device that's made specifically for, cervical rehabilitation versus, like I said, some of these other kind of makeshift exercises and things that don't seem to be as effective or have like, weirder setups and, take more time to instruct someone through. So they like that, they can get their head on this platform and start moving it pretty quickly and effectively. A lot of them like to actually feel like they're doing work with it too. They can give us the feedback of, oh, I do feel these muscles working in an effective way. And I think that's just been something that's different than a lot of the other types of exercises and interventions that we've had in the past.
That was one of the main motivations for me in developing this device. I was surprised looking around clinics as a PT student, seeing people wrap TheraBands around their head and pull them away from it, or like you said, like a half deflated ball and lying on top of that, or pushing your head against a ball into the wall. It all just seems sort of primordial, as if we hadn't really thought through neck rehabilitation. And so that was one of the primary motivators for me. We had to bring some legitimacy to neck rehabilitation. I feel like physical therapists have been kind of silently crying out for something that they could use with their patients that would bring some legitimacy, something that a patient would use and say, yeah, this makes sense, and it was designed for treating my neck, as opposed to wrapping a band around their head where, they're going to think, what is this? Is this a legit thing? Like, why am I doing this? I see people doing shoulder rehab over there, and that looks all very formidable and planned out. And this just seems kind of haphazardly put together. So that was one of the main motivations for me in developing the device. And it's just great to hear that other physical therapists would agree that their patients actually are enjoying using something that feels like it was designed just for their issue.
Yeah, totally.
So can you describe a little bit more in depth how you go about using the device with your patients? So what your favorite exercises are, and what a standard routine on the NecksLevel device looks like for one of your patients.
Sure. Oftentimes when I, day one starting to use it, I'll have them lay on it and just kind of use that as a little bit of an assessment of their range of motion. So I'll go through some of the rotations with them, just looking at how they're moving on the device without any resistance, working in some of the flexion extension, side bending, and just like kind of getting their feedback too. Like, how does this feel? Like, what are you feeling as you're doing this sort of thing? As you're on this device, am I noticing any, movement impairments of like not moving all the way to one way or versus the other? Or like, are they, deviating from the planes of motion that we're trying to achieve? And then from there, a lot of kind of verbal and hands-on guidance to try to achieve that normal mobility if possible, so that we can start to retrain the way that they're moving. And so say that they're able to do that well, and they've responded well to just like getting them moving correctly without any resistance. Let's add some resistance. Let's work through some of the eccentric protocol. I find to be nice to do initially, so that they're not like straining and pushing into these ranges of motion yet, but they're like getting that assistance and then kind of working their muscles in that eccentric fashion. Maybe say someone's a little bit more on the acute or higher irritability spectrum, and they don't have comfortable mobility even on the NecksLevel, which actually I've found to be not as true as having them, sitting or standing, moving their neck. Like a lot of times people getting on that platform, having that support and then moving, like generally feel a lot better anyway. But say someone can't, and they've, they're unable to, let's say, rotate to the left without having any sort of discomfort yet. we can start with some of the isometric loading protocols and having them use those muscles in an isometric fashion, low load, like kind of longer duration, and just getting them more comfortable using their body that way, then working into some of those eccentric motions, then working concentrics, so that's where I've started with typically. And then you can definitely progress. It makes it easy to progress with the different resistances, progressing into some of those, greater ranges of motion, working the concentrics, things like that later on.
Now, when you're teaching patients how to use the device, how would you describe the general process? Because a lot of PT clinics use aides as in their support team to help with, offload the physical therapist so that they can go and treat other patients. How does that all work out for you guys? Do you use aides with your exercise programs? And if so, has this device freed you guys up in any way, whereas previously you were more, tied down with a single patient?
Yeah, definitely. The aides, basically from the day that we trained all of the therapists in the clinic to use it, we had started to train the aides on the same exercises and everything on the NecksLevel. So they now are very comfortable teaching patients how to use it. And because it's a very easy, user-friendly device, then they don't have to do as much cueing that might require more of the, skilled PT type of instruction as some of these other previous exercises. So they can, again, just get the patient on it from day one and start to work through some of the exercises that the PT wants them to do. And I haven't really found any issues with that yet. If it's someone that I suspect might have a harder time using it from a patient perspective, then I'll spend a little bit more time with them initially doing it. But people tend to, learn how to use it within 1 or 2 treatment sessions. So, it's not something that you have to spend a ton of time teaching them. And that does allow us to move to the next patient in a clinic that we, see patients on the every half hour. So yeah, it's been pretty easy and seamless to just work right into the system we already have going.
So for other high volume clinics similar to Moti, would you recommend the NecksLevel device for their neck rehabilitation? And if so, what are the reasons you would?
Yeah, totally. It's just very seamless in the transition into someone's treatment program from what they were previously doing. It's quick to learn, easy. I love that it's the, size and the way that it is. It's easy to transport around a bigger high volume clinic too. So, in a space like what we have here where we've got, 9 or 10 treatment tables and a big space where we can use the floor, like you can take it from where it was and just bring it over to the next treatment, and you can move it from place to place. And so that's really great about it. You don't have to hook it up to other sorts of machinery, or doesn't have to stay in its spot. So that's been one of the really great things about using it. And yeah, it's easy to use and easy to learn how to use. So you don't have to spend a ton of time teaching the patient or your aide or assistant how to use it.
Is there anything else you'd like to share about the NecksLevel device that you feel like we haven't covered very well so far?
So when I first got the NecksLevel, I had a lot of people on my caseload that had neck pain, and some of them we were reaching this point where it was like, you're good, but there's still kind of a missing link, and we're not fully getting you to where you want to be. And then actually using that strengthening protocol, starting with some of the isometrics and working our way up from there, kind of got them there, which was great. It was kind of that missing piece to a lot of, I think, people's rehabilitation. So that was something I noticed right off the bat. And I think my colleagues have too. And So that's been fun to work with.
Well, Jake, thank you for joining us today. It was a pleasure talking with you, and I wish you the best of success and continued busyness in your clinical setting. So thank you again for sitting down with us.
Yeah, of course. Thank you.